Desiree Shaw, registered certified licensed psychotherapist, CBT therapist, and counselor. On a mission to make therapy accessible and change the world one thought at a time. Don't miss out. Subscribe, like, and share for more on men's mental health and relationships.
Hello and welcome. My name is Desiree Shaw. I'm a psychotherapist and I vlog and I podcast. Welcome to Progressive Muscle Relaxation. This is a mindfulness, a grounding, relaxating. I just make up words, don't I? This is a relaxing podcast. This is a way of bringing yourself back into the present moment of right now. This is a way of getting into your body. This is a way of learning how to progressively relax your muscles. So what is PMR? PMR is a technique that you can use any point, anywhere to support yourself to get back into the present moment of now, to get yourself back into your body. When we're anxious, when we're depressed, when we're angry, when we're feeling really intense negative emotions like hurt, when we feel disappointed, when we feel alone, we tend to rush into the future. We tend to fear the absolute worst. We catastrophize. We see things as being much bigger than they are, that we can't handle it. We underestimate our ability to handle it, overestimate how terrible it actually is, and ultimately see the absolute worst. And the more we see that, the more we engage with the thought of things just being terrible. And our body responds to that. We get into our fight, flight, freeze. We try to get away, we flight, we try to fight our way out of it, push through, lash out, or we freeze and we don't know what to do. All three options are great when you're under attack and you're in imminent danger. However, when you're not in imminent danger and it's dealing with a presentation at work, it's dealing with difficulties in your relationships, managing your finances, going through life, the fear, feeling an imposter, that you're just not going to be able to get through, that things are never going to work out for you. And the cortisol starts rushing around your body, the adrenaline starts rushing around your body, and you think you've got to act, but you don't know what you've got to do, and you can't sleep, you can't eat, you can't think straight, because you're not inside of yourself, you're outside of yourself trying to fix everything from the outside in. PMR is a way of getting back into your body. It's a powerful tool. You can use it for pain relief. You can use it to get yourself back to sleep. You can use it to manage anxiety and panic attacks, which just seem to take over your life, basically. So I'm going to take you through a Pmr script that I wrote. And the process of this is that you can get yourself back into this present moment of right now, being present, being comfortable with yourself. All right. So first of all, I'm going to ask you to sit down or lie down in a comfortable position. Now, if you're seated, make sure your feet are firmly planted on the floor. You can still have your shoes on or your socks, or you can be barefoot. It's up to you. But sit right back in your chair so that your back is fully supported on the backrest of the chair, so you can feel your weight in the chair. And if you're lying down, feel the weightlessness of your body where you lay, okay? And notice how that feels. You're going to be doing a lot of noticing. This is a simple way of getting yourself relaxed and ready and present in the here and now. Because in the here and now, that is when you can make the changes that you need to make in order to respond effectively so you can get the best out of the situation that you're in. So you're lying down, you're sitting down right now. I would like you to close your eyes, but if you don't want to close your eyes, you can keep them open and rest your gaze at something in front of you, something simple, something nearby. So starting with some breaths, as your breath is the anchor, this is where you're going to keep your focus, because this is your control center, your breath. Take in a simple breath and release it. Just let it go. And just notice how that felt. Try another one and release it. Now, make that breath deeper. Fill your lungs and notice the release on the exhale. This time, when you take a deep breath, hold it for just a second or two, whatever suits you. Then release it. Again. And slower this time. Breathe in and hold. And release it. Release the air. Notice how that felt. Now even slower now. Breathe in. And as you breathe in, expand inside yourself. Notice your stomach. Notice your chest. Notice how you felt as you opened up into that big, deep breath. Now, breathe out, releasing it. And notice the difference from the expansion to how it feels when you let it out. Noticing how breathing feels. The difference between your normal breaths and your deeper breaths. Breathe in, another deep, nice, full breath. And breathe out. And notice the changes in your body. Maybe you feel looser or notice where the tension is. Your job is to be in charge of your breathing. You control the in and out. When I ask you to tense, I ask you to bring in the tension or notice the tension. That is your cue to hold onto the breath. And when I tell you to let go, that is when you release the breath and the tension. Now we're going to get into your body starting from your feet. Your attention is at your feet. Notice everything about your feet. If you're wearing socks or shoes or you're barefoot, what do you feel on your feet? Now you're going to clench your toes and arch your feet. Curl your feet up as tight as you can, curling them inwards. And as you do so, take in a deep breath. Now, as you are clenching and holding that breath, keep that tension in your feet and notice it, all that it feels like and all that is uncomfortable. Hold that breath. Now let it go. Let your feet uncurl, unclench your toes, and release that breath. And notice what that feels like. What that relaxing feeling of letting go feels like. It's a new feeling to your feet, and it probably feels good. Now moving up your body to your shins and your calves. This is a strange area. We don't really notice our shins and calves throughout the day. I want you to tense those muscles and hold on to that tension and hold that breath. Only noticing the tension of that feeling, how your whole body has to engage to tense them. Hold it and notice it. And let it go. Release that feeling from your calves and your shins. Let go of that breath. Notice the difference. Notice the relaxation. Notice it all. Now take in a couple deep breaths, slowly and evenly. Now moving up to your thighs and your hips. I want you to tense your thighs together, squeeze them as tight as you can, but without straining. Just tense. And on that tension, hold that breath. Bring in that breath into your body as you hold in that tension. And let it go. You might sigh as you let it go. You might make sounds as you breathe in and out. That's fine. Feel the tension leave your legs. Notice how your body has brought itself into a natural rhythm with the hold and the tension and the release of the tension. Now moving up to your stomach area, your lower back and your chest, and that middle body where you might hold a lot of your tension. Take in a deep breath. And as you take in that deep breath, tense your stomach as if crunching inwards. And hold it with the breath. Just hold it. Feel that tension. You might have to curl slightly. Now release that tension. Release that breath. Let your body simply fall back into your chair or where you lay and let it go. Just noticing the difference between the tension and the relaxation. Keeping with those deep breaths, filling your lungs and releasing your lungs, always breathing in and out. Expanding your body with the breath. Inside yourself, you notice how you can fill your entire body with air on the inhale and releasing that on the exhale. Now moving towards your shoulders and your upper back area. We tend to keep a lot of tension up here in our shoulders. Take in that deep breath, and as you take in that deep breath, as you inhale, tense those shoulders and your back. Squeezing your shoulders up to your ears and hold it. Hold it with the breath. Just hold it. It might feel uncomfortable. Just simply notice that. Now let it go. Release it. And let your body flop into the chair or where you lay. You might notice how different your body feels right now. Allow yourself to notice that. Now move into your arms, all the way to your hands and your fingers. On the inhale, I want you to clench your fists and tense your arms and squeeze as tight as you can on the in-breath and hold it. Now let it go. Open your fists, releasing that tension. Let your arms go limp. Let your body feel that difference. Release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, your hands, your arms, and your shoulders. Notice how your arms feel limp and at ease. Now take a deep breath as we move up to your neck, your face, and your head. On the in-breath, I want you to contort your face by squeezing your eyes together, pursing your lips, and gritting your teeth until you feel your neck engage in the tension. Hold it. It might feel weird, but hold it. Now let it go. Let it all go. Let go of that breath. Let go of that tension. Release your eyes, your gritted teeth. Notice that tension leaving your body. Notice how your face feels relaxed on the release. Now we're going to bring it all together. All that tension that we breathed in different parts of our body. You're now going to tense your entire body. Just how we did, progressively, bit by bit, but all together this time. I want you, on the in-breath, as you breathe in, to tense your calves, your feet, curl your toes, arch your feet, squeeze your thighs together, crunch your stomach inwards, raise your shoulders to your ears, grit your teeth, contort your face, squeeze your eyes together, purse your lips, your neck, engage with that deep breath in with the tension. And hold it. Hold on to all that tension. Just noticing all that you can notice. Now let it all go. Let your whole body just flop. Notice how it feels as you release that breath, releasing all that tension in your body, releasing your shoulders, releasing your fists, releasing your feet. Just let it flop and just notice what that felt like. You have successfully, progressively relaxed your muscles. You have noticed something powerful, that you are in charge and you create the feelings in your body. Progressive muscle relaxation is like a superpower. It's something you can do any point, anytime, anywhere. You may just want to do one part of your body to tense and release and just notice how it feels, bringing you back into this moment of right now, bringing you into your mindful space. You can use this at any point. You might suffer from panic attacks, anxiety attacks, and bringing that focus into your body is a way of you dealing with that panic, dealing with that anxiety. Just being present, just being right now, so you can deal and you can respond and you can manage and you can handle. We've come to the end of this segment. I want you to slowly and gently bring yourself back into your room, wherever you sit or wherever you lay, by slowly moving your muscles, maybe stretching, maybe releasing that back a bit more, maybe you roll your head back and forth gently, maybe you stretch your arms, maybe you curl and uncurl your toes and then spread them out Maybe you squeeze your thighs. This is your superpower. You can use this anytime. This is how you progressively relax. Thank you so much for listening. My name is Desiree Shaw. I hope you enjoyed this. I practice at the Priory and privately. I'm on a mission to make therapy accessible and change the world, one thought at a time. Bye for now.
Desiree Shaw, registered certified licensed psychotherapist, CBT therapist, and counselor. On a mission to make therapy accessible and change the world, one thought at a time. Don't miss out. Subscribe, like, and share for more on men's mental health and relationships.